What are your suggestions for us to build a quality management system that does increase value in healthcare?
The measurement system can't be merely reactive to the regulatory requirements. It can't just begin and end with the requirements, whether they're the merit-based incentive payment system, that's MIPS requirements, the APM performance pathway, that's the APP requirements, the healthcare effectiveness data and information set, that's HEDIS, or any other federal, state, or insurer sourced requirements. I define system in the last question as the people, processes and technology that deliver on your intentions. Your people have to be involved. There needs to be a shared understanding of what you intend to deliver to your patients. What are the essential elements of that product, service, or set of products and services? What risks or errors does your system need to address? It's essential that everyone on the team knows where those policies are kept, has a hand in creating them and updating them when they need to be updated. Now, processes need to be documented. Think policies and procedures. It should be written. It should not only be accessible, but also routinely accessed. The moment we start relying on memory to keep us on track is when errors start to happen. It needs to be dynamic. When there is awareness of novel errors, that's new errors to our system, it should be updated to prevent recurrence. When there's new evidence, it must be updated to deliver the new intentions. Despite the existence of written protocols, your practice should not be in service to the protocols, but the protocols must be in service to your practice. Depart from the protocols when you need to and update the protocols to address that same need in the future. Optimize your current use of technology. There are three parts to your foundation of technology. One, a patient portal. Get input from your patients, give output to your patients, and provide secure and reliable communication. Don't think in terms of a web-based portal, but as a help desk that provides access for your patients how they want it and when they want it. It might include phone access, text messaging, secure messaging, whatever they want and whatever they feel comfortable getting answers from you about their health. It includes an electronic health record to hold data about your patients and your encounters with them, to efficiently and effectively access data about your patients, and to correct misinformation and track changes in your understanding and diagnoses relative to that patient and treatment plans over time. You want fast and effective data entry as close to the data as possible. And when I say as close to the data, that means collect your patient's words whenever possible. And whoever in your practice collects the data, have them document that at the time rather than passing that on to the doctor. You want fast and effective data access, standardized structured language and location for every important element of the data. But when you're documenting, you want to keep that brief and clear. You should not document anything that's already in the chart. That excess documentation then tends to weigh down the chart and be ultimately a barrier to data access. You need a measurement system to identify met and unmet healthcare needs in your patients. There are not, as common measurement regulatory systems tend to imply, 6 measures that define the quality of your care. Medical evidence suggests tens of thousands of individual interventions, each represented by a potential measure needed by our patient population. Your system should be able to measure the subset of those evidence-based interventions that are applicable to your practice. There is a vital interaction between your EHR and your measurement system. Your EHR must hold your best current understanding of the data elements that sort your patients into denominators, of the data elements that show the met status of your patients on any intervention you intend to provide, and of the exceptions or exclusions that apply. Your measurement system must reflect your best current understanding of the desired relationship between the denominator elements, numerator elements, and exclusion exception elements. So a lot of work to be done, and it's not going to be completed if we just limit our vision to the regulatory requirements.